Hello, everybody. Welcome to I Was Supposed to Have a Baby's Insta Live, where we tonight are going to be talking with Michael Bleicher, who is a licensed clinical social worker, and he is going to be talking to all of us about how to talk to our partners when we're struggling with fertility issues, how to get support for yourself, how to support other people, and just discussing issues more in depth to really give a better sense and a better, really a better handle for all of us on how to bring these topics to the fore and how to get support. So, Michael Bleicher, how are you?
Great. Thank you for having me on this evening.
We're so excited to have you. Okay, so let's jump right into it. Please introduce yourself. Tell everybody who you are. You have a tremendous resume and you've done lots of things in the fertility space and beyond. So please introduce yourself and tell people who you are and why you're a tremendous expert here.
So I don't know that I'm a tremendous expert. I am Bleicher. I'm a licensed clinical social worker, and I specialize in supporting individuals and couples who are struggling with infertility, with reproductive loss, with perinatal mood and anxiety disorders. And it's just become a passion of mine to try and be able to do what I can to support couples, to be able to educate communities and community leaders in this space. I have the privilege of being the Director of Clinical Training and Achieve Behavioral Health in Muncie, where we are launching, God willing, very soon, a new women's health program that will initially be focused on supporting the needs of women who are struggling with postpartum anxiety and depression, and soon enough struggling with infertility. And we know that typically what happens is that men are not eager to look for help or to ask for help. We tend to be less emotionally attuned, less expressive, less eager to share and self-disclose. And so what happens is, in my experience in facilitating support groups for men who are struggling with infertility with organizations like usually it's the woman who's in a group already and she kind of nudges her husband to get in there and get some help because there's only so much that she can do. She's at her wit's end. And so what we recognize is that by building support for women, usually their husbands are able to access care as well. What's interesting is that men don't want to join a support group for infertility. They don't want to join a therapy session. We have to come up with creative ways of marketing to men because we need to sell it to them in a different way. And so an information session, an Insta Live, something that's not as stigmatizing, unfortunately, because stigma's out there, even though you and I think that this is great. You know, we should talk about this publicly and we're going to shout it rooftops.
Right.
The reality is that not everybody feels that way just yet.
Right, absolutely. I think, you're just reminding me of the fact that I remember when before I started, I Was Supposed to Have a Baby. I worked for a number of years with Reba Judas at Nechama Comfort. And I remember we were sitting in a New Jersey state infant mortality meeting. It was a consortium of different representatives from different organizations all around New Jersey. And there was one organization who kept saying, we keep trying to have events for men. We've tried having like meetups at bars. We've tried doing, things at, the sporting events. We've tried all kinds of things and we can't seem to get them there. So I very much appreciate this like marketing challenge that you were mentioning.
Yeah. It's a challenge for organizations. I think one of the privileges of being in private practice as well is that, people come when they're looking for help, they know how to find it. And so organizations can refer them, social media platforms like this draw attention and allow people to know that there's support not only for women, but also for men. And in a way that's comfortable, they can reach out to people that they trust. And one of the things that's really special is, I think being able to be a licensed mental health professional who not only is able to provide support, but also clinical tools, interventions that they can use at home, that they can bring out of a session into their life, and really having that training through, let's say, the American Society for Reproductive Medicine to understand what's their journey looking like, what's the lingo, because when a couple COVID changed everything, right? A husband and wife would go into a clinic and they would hear the same doctor's presentation or spiel at the end of the appointment. And they would know, okay, what are the next steps? And if one didn't understand it, the other one could
Right.
kind of correct them. Now with COVID, people, sometimes men are not able to enter the clinic. They have to wait outside. And so it's entirely dependent on one patient who's typically overwhelmed, and it's very early in the morning and there's a lot going on, and they have to kind of like hold on to all the details that they have to share with their husband or with somebody else who's going to inquire about it later. And it's very difficult to be able to understand where they are on their journey. And so having somebody who understands not only how to support them emotionally as a therapist, but also who has training and understanding what the medical nuances are, and who can guide them and say, I'm not sure you got that right. Maybe give a call to your doctor's office again, speak to a nurse, clarify that, because empowering people helps take away some of the hopelessness and the loneliness that they feel when they rely dependably on the support network that exists around them.
Absolutely. And I think, what I wanted to do with you today is also what I wanted to do with you today was also really get into depth into some of these really some of these issues specifically. We talk about here at I Was Supposed to Have a Baby, we talk about anyone who's struggling with any kind of fertility challenge, right? So it's people who are dealing with infertility, and we know the subsets of infertility in general. It could be female factor infertility, it could be male factor infertility, it could be unexplained. There could be 1,000 reasons why someone is infertile that have nothing specifically to do with one or the other. Maybe it's both. We know that that's a possibility as well. But in your practice, and frankly also in the people that we see, these struggles are really much more broad than just infertility, right? It's people who are wanting to have a child who have no trouble conceiving, and people who've had a loss unexpectedly, totally out of the blue. They never thought that this was ever going to happen again. Or maybe it's people who knew that there was going to be some kind of issue, but they didn't know exactly what it was going to be like, and they end up needing to do IVF for genetic reasons. They end up with needing to use a surrogate, or they fall back on adoption. But I'm mentioning all of these pieces because there's a common thread that runs through it, right? And this is what I brought you here to talk about. This idea that there is one scenario. The scenario is you can't have a baby, or you're struggling to have a baby, or you lose a baby, but there are two people going through that scenario. And we know that from a biological standpoint, it's someone who has female anatomy or is of the female persuasion, female gender. Non-binary or people who have female anatomy are the ones who are carrying the pregnancies and dealing with all of these kinds of appointments. I'm trying to be as over-inclusive as possible here. And so the question is what do you suggest? And how do we think about this very separate but very together kind of struggle?
So that's a great point, right? Two people have a shared vision in this relationship of growing their family by having a child. And for one reason or another, they're struggling with being able to realize that potential. Now, the challenge is that even though they have a shared vision, they're coping with it in different ways, primarily because they're different people. They come from different families. They've learned different coping skills. They've experienced different kinds of challenges and adversity in their own lives. And so I think sometimes partners go into this struggle thinking like, oh, I can lean on my partner because they're going to be going through it the same way that I am. And if I'm crying, they're going to be crying with me. Or if I'm happy today, they're going to be happy with me. And when there's a mismatch in that, when they're not coping in the same way at the same time, there's almost like, what? How is this possible? Well, do you not feel what I'm feeling? Do you not share this experience with me? And so I think it's important for us to recognize that it's okay for us to cope in different ways, and that we can acknowledge that regardless of how you're reacting, we're both reacting to a very abnormal situation. As normal and common as we can normalize this experience for 1 in 5 or 1 in 6 couples, that's still not the majority. And that is a good reason for them to feel like this is a crisis. We're struggling here. we don't want to avoid or minimize anybody's experience or their reaction. And for them to say, like, I get it. I know why you're reacting that way. I'm going to put your comments and your outbursts and your irritability into context, or your sadness about why this is so hard days, weeks later, to be able to shake it from it. There's research that shows that a couple who experience a loss, a failed IVF cycle, so they can be impacted, they can display depressive symptoms 18 months after a failed cycle. And everybody around them is saying, oh, just pick yourselves up and try again. And maybe one of us is not ready for that. Maybe we just don't have it in us. And so, let's not minimize the pain of that experience. Another thing I think that is helpful is to just listen. The topic that we posted is, the title is, how to listen, but also how to listen so that the other person can hear you, and to hear it so that the other one can listen. And so when we listen, we're not thinking, oh, I'm going to fix this, right? Unfortunately, this is something that we can't fix right away. I've had clients who are very successful in their professions, and they have, great educations, and they've done well in everything in their life except for being able to grow their family. It's a different kind of experience. And so don't say, like, oh, we're going to get through it. This is the first time that somebody might be experiencing this kind of challenge to this extent. And just seeing that in your partner, the sense of disappointment and hopelessness that comes in with that, is really hard.
Right. You can't just, this is the kind of thing that you can't just, study really hard for that test and know that you're going to get an A. Like it doesn't, this is not about, the work that you put into it. On some level, it obviously, yes, you can't wish away your infertility. Yes, you do have to put in the work, so to speak, and see doctors and do investigations and so on and so forth. But it's not about, if you get to the right doctor and you get to the right medicine and you can do all of the right things and still not be successful.
Right. Right. And it takes a while to be able to wrap your head around that. And it's really hard. I think sometimes family members, extended family, where they're expecting to become grandparents, they're expecting to become uncles and aunts and nieces and nephews. They don't understand how hard that can be. And so for family to be able to make space for a couple, to say, we're going to adjust our family's needs around yours. We're going to give you space. We'll make a Hanukkah party. Hanukkah's coming up. And, is there a way, what can we do to adjust to make you comfortable while still being part of the family? Because no matter what, you'll always be important to us. You matter to us. We love you, regardless of how many children and grandchildren are walking through our door. And that's a message that I think doesn't get conveyed frequently enough. And
Right.
for to be able to share, my mother is not expecting you to do X, Y, or Z. And we can just show up as we are.
1,000%. I think that there is, people often discuss this idea about how, like, the women are the ones who are carrying this burden, right? The women are the ones who are going to these appointments. They're getting the shots. They're the ones with the emotional changes, the hormonal changes, the physical changes. They're dealing with the practicalities on a daily basis when they're either trying to conceive, or when they're, if God forbid they lose a baby, then their body is obviously, going through all of those hormonal and physical changes. And so the women are often left sort of holding so much of this and not able to understand how the man or their partner can't see that they're in pain, or it's very hard for them to convey how much they're actually holding. And then also, we also hear, and I wanted you to talk maybe about both of these pieces. I also hear from people who are dealing with male infertility, right? It's the women. Like I hear this refrain all the time from the women: I'm fine. There's nothing wrong with me. And yet I have to go through all of these treatments and do all of these things. And the resentment on some level, right? We're not even touching about like this is my fault. Of course, we know it's not anyone's fault. No one, did anything to cause their infertility. But these emotions are very tricky, and especially in a relationship, it's very hard to manage. So I'm wondering if you could speak a little bit about some of those pieces.
I heard it just earlier today, a woman who's describing her husband's struggle with male factor infertility. But the general assumption of society, perhaps because it's the woman who's going for treatment, she's the one who's undergoing the interventions, even if he's gone for TESE surgery, he's gone for other kinds of diagnostic testing, she's the one who's going to be undergoing the bulk of the treatments. And so somehow we just project that, oh, it must be female factor infertility. If only she would do this. And so everyone's watching her to see, maybe you shouldn't be drinking that wine, and maybe you shouldn't be eating that, and you should make this lifestyle change in your soap and your deodorant and your shampoo and things like that, and plastics in the home. And perhaps there is some support and research that supports that, but also to recognize that we're not going to point fingers when a couple isn't able to grow their family, and that doesn't help them move forward in their journey. What you were talking about before, I think, in terms of husbands and wives and partners not being able to express themselves and understand and see the pain that the other one is going through. So the truth is that, as I mentioned before, women are more likely to self-disclose to family and to friends. They're more likely to be able to access social support by talking about it with other people. And men tend to bury themselves in their work, or get more involved in working out, and they're going to distract themselves from it because it's too painful and they don't actually know how to deal with it. They can't bring words to their feelings, but their feelings are coming out in other ways. They're more irritable, they're snapping at people, they're withdrawing from friends. And over time, if they are becoming resentful of their wives because, even though it's male factor and it is their primary contribution to this challenge, right? She's the one who's not able to bring home a positive pregnancy test, and he's waiting for that. And if only she would do X, Y, and Z. And that creates a lot of tension in the couple. And so additionally, even when a man is able to understand what he's feeling, he feels like, oh, I need to be strong for her. If I just express myself, I'm going to overburden her with my feelings, that there isn't space. I don't have a legitimate right to feel that pain. And what research actually shows is that wives want to hear what their husbands are feeling. They don't see it as a burden. They see it as a way of, oh, you are with me. You do have a heart. You are in pain. And even though you're not crying with me and you're not using up boxes of tissues, you're still struggling in your own way. And being able to invite, to have somebody say, what are you feeling today? How was today for you? And to really take an interest and open up space for that. I think that there are a couple of ways to do that.
I'm also going to just add, and I want you to answer, what if he doesn't want to talk, or what if she doesn't want to talk? Like, how do you then, like, as the other person in that partnership, that couple who needs to emote and needs some give and take, what if the person doesn't want to?
So I think that when one person has a need, this isn't so dissimilar from other needs that one partner may have that the other doesn't. And so how does one support the needs of another when they don't share that need? And so if we can say, I want to help you, I want to fill that need, even though I don't have it myself. So can I create space for that? So one of the most helpful ways for, I think, usually it's the man who doesn't want to enter into that conversation, but his wife has a need to tell him about how she's feeling and how horrible her day was. So he's afraid, like, well, if I open it up by saying, how was your day? Then she's just going to, spill it all over me, and it's going to wreck my night. So what I recommend is having like a temperature check-in. During COVID, everyone, wherever you went, you check your temperature, they had the scanners. So can we just check in, and can we set a time to do that on a consistent basis that's predictable? And perhaps if we're concerned, if one of them is concerned that, well, if I do that, then this is going to take like forever. So let's set a timer so that he feels comfortable knowing he can enter, and that they both know that there's going to be a time when this is going to be over. Not permanently, but temporarily until tomorrow night. And then she might write down some of the things that she wants to share in this check-in space, in this time. And maybe they have a certain place in their home, and a cup of tea or hot chocolate or coffee or whatever works for them, so that it's a comfortable place, but it's not open-ended, so that he can feel comfortable knowing I can step in and this is going to end soon. Because I think that's part of what isn't available when we're struggling with infertility is we don't know when this is going to end. But if I know when this emotional connection is going to end, then I'm more willing to be vulnerable and open myself up to that.
I love that. Because it's really practical and very concrete in terms of giving each partner what they need. The person who's non-emotive wants to make their spouse feel loved and feel supported, but they don't know how, and feel stymied by the fact that they're worried there's just going to be this emotional diarrhea, or this verbal diarrhea, as people like to call it. But the other person feels this deep need and needs to get it out. I love that. I think it's phenomenal.
And it is so,
Um,
it is an opportunity. They begin to recognize, like, okay, so now we can take a step forward. We come out of this space and we're closer. We're closer because we understand each other, and we're not trying to fix it. We're just trying to check in and make sure that we are able to attend to each other's needs. Because if we're not talking about what we need, then we're not going to be able to, the other person is not going to feel like we're supporting them. And that's where the resentment comes in. Because not only am I going for treatment, but you're not doing anything to help me.
Absolutely, absolutely. I other, other suggestions that you give to people when they're having difficulty communicating, or having difficulty even just opening that up because they're afraid to, like, really show how they're feeling. Sometimes people, like, you've talked about this here, people feel that they need to be strong, and they don't want to open the floodgates, so to speak. What are ways to kind of tease that out, and to let, so that that person who doesn't want to open the floodgates feels safe that they can, and the other person feels like they've actually have a living, breathing partner on the other side? Sorry for the metaphor there.
Yeah. I think in the example, in the practical tip that I just shared of like sitting down and having a cup of tea, for some people that's really great, and it creates a warm space. For others, that can actually be very anxiety provoking because
I,
I'm
yeah,
ready.
I was actually just going to say, as someone who doesn't like to be told, like, okay, and now we're going to talk. Like, for me,
Right.
I'm recognizing that's beautiful, but for me, I'm like, oh God, like, now what am I going to have to say? So yes, please say more.
Instead of sitting and having to talk, sometimes I encourage couples to go out and notice three things outside that you didn't notice yesterday. And that creativity and opening themselves up to something different creates a bond that then lays the groundwork for being open a little bit about what they're feeling. Like, okay, so now we're having a little bit of fun. Can I share something with you? And because of the strength and dynamic that they've created, they're now a little bit stronger to be able to hold that difficult emotion that's bothering their partner. And I think very often, because fertility treatments are so time consuming and they're so expensive and they're so emotionally exhausting, couples forget that they used to date and they used to have fun together and life used to be enjoyable. And every once in a while, I'm not saying that they can do it all the time because there is a lot to do in life. But if we can schedule some times to have fun and to go out and relieve some stress, to go on a run together, couples that have gone axe throwing and to a shooting range, right? Really get out that stress.
Totally.
And it allows them to turn back towards each other after that activity or during that activity in a different way because it relieved some of the stress. And I'm not depending on you to have to do it for me anymore. We've just done that together. And so now that we've given each other that gift, so now our stress levels are lower, we're in a better mood. The way that we express those emotions will not be with diarrhea, but with kindness and consideration in a way that we might not have been able to do before we took care of ourselves.
I love that. I think, I think you're exactly right in that there are lots of different kinds of personalities and different kinds of relationships, and the interplay between people. And the question is how to reach your partner, not the general, male out there who, that's the topic of this general conversation, but how to reach your partner, how to reach your person, because at the end of the day, it's about building connection with your person.
Yeah.
Um,
Part of that is also being able to feel comfortable in asking for what they need. So if they need partner's attention, if they need time, if they need to go somewhere, right? To know that I can trust that if I ask you for something, that you can meet that need, to be able to maintain that bond. And if they're able to be successful in meeting their needs by advocating for themselves, that means that they're more likely to be able to do that with friends, with nurses, with doctors, and in other places, which is able to combat the sense of helplessness that they often feel. And so that's a really important skill. And so, hey, let's go out to a comedy show to escape the room. Let's have fun together. Or I really, I'm just zonked. I need you to take care of the insurance bills. Can you take care of that, of fighting with them? I'm done fighting with insurance. I'm fighting at the doctor's office. They keep stabbing me in the arm and I have to pay extra for it. And like, what can you do to help me in that space? And so maybe he can help with scheduling. Maybe they can, share a calendar. Maybe he can do some of the logistics around the treatment so that even though he's not the one who's having the injection into his body, he's picking up the medication. He's helping her relax before she needs to do that if it's something that's really uncomfortable for her. And so just checking in about, while we're going for treatment and, I understand that your mood is not quite the same as it usually is. Is there anything that I can do to cheer you up? Is there anything that we can do together? Or can you explain to me what you need from me, while we go through this 2-week wait? Is there something that would be more comfortable for you? And often when that happens, he's able to say, that means a lot to me. I would love to do that with you too. And so she says, oh, you have needs too. And they back at it.
Shocker that two people actually do have needs, right? And the stone wall actually does have feelings. It's a shocker.
Yeah.
Yes. Okay, so to close out this conversation here, I guess my final question is, what, how, for someone who is not talking, and whether that's, for any of the reasons we mentioned, or maybe it's also because they're so deep down in that space of feeling that pain that they don't even know where to begin. And maybe it's time for therapy, or maybe it's time for medication. How does one begin to broach that with your partner when they're not talking, they're not emoting, they're not opening up? Whether you need it, whether they need it, you're not sure. These kinds of more difficult conversations to have. How would you suggest people broach that kind of a conversation?
It's a really important question because often when a person is struggling with depression, they don't recognize it in themselves. They know that something's off. They know that their energy level is different, their sense of, internal motivation that gets them up in the morning and to keep doing all the things that they enjoy. And they're not doing that anymore, but they don't know why, and they can't figure out how to jumpstart that engine again. And it's often a loved one, a partner, a parent, a sibling, who notices a significant change in their daily life. And so for someone who cares about them to come to them and say, I really care, I love you, and I see that you're struggling. And if they know that it's about the infertility, then we can just name that and say, I know this journey must be really hard. You've been on it for so long. And I hope that, you are able, to see that joy that you're yearning for. But until that happens, maybe there's someone who can support you in addition to the partner that you have and the family that you have. Maybe it would be helpful to speak to someone and to let your doctor know about how you've been feeling over the past couple of months. The depression scale is not only something that looks at you today, but it assesses back 2 weeks. It often, 2 weeks, when a good doctor will not just ask you to check off boxes, but tell me about that. What has your sleep been like? What has your appetite been like? And how long has that been going on for? And you begin to notice a pattern of, I'm really struggling here. And somebody who cares can say it like, I want you to get the help that you need, not only to be able to grow your family, but to be able to take care of yourself. Because research shows that when a person's mental health is suffering, when they're struggling with anxiety and depression, so from a male perspective, there is research to suggest that it has a negative impact on the quality of a man's sperm. And so that has a direct impact on their reproductive potential at that moment. And so if we can connect those two things to say, your physical health matters and your emotional health matters, And I know that you're going to the best REIs and specialists that you can, but in order for you to really take care of yourself, I want to help you take care of your emotional well-being too. And here's a referral, or would you like me to make a call to get the name of a specialist, or maybe you could speak to your doctor. Most REIs and nurses, they have somebody that they can refer them to. The challenge is that the clinics often have, they might have a social worker on staff, but they're going to offer them 1 to 2 sessions. It's nice, but as I said to an REI recently, nobody's going to get very much out of 1 to 2 sessions. They're lucky if a man is going to open up in 1 to 2 sessions.
Right.
So having somebody that you can refer to and that you trust is really, really the most important thing. Because if you tell them, I think you need help, go figure it out. It's like, oh, so now you're giving me another thing to do. That's not very
Exactly.
helpful. But can I help you with that? Would you like me to get the name or somebody who I know has current availability? Because since COVID, there's such a crisis in availability and capacity in the mental health space. Can I get you somebody who can see you within a week or two? And see what happens. And if they say no, I'm fine, and you see that their condition continues to decline, it's okay to revisit that gently and to say, I know that a couple weeks ago when we talked about it, you didn't need any help, but I'm noticing that it's getting worse. And I love you and I care about you. And I want to be able to see you smiling again and feeling your best and doing all the things that you used to do, calling me as often as you used to, rather than feeling like you're not good enough to talk to.
Thank you. I really felt like we couldn't end this kind of a conversation without bringing up that last point, because, discussing possibly, discussing therapy, discussing a therapist, discussing medication with someone is always a touchy subject. And we all need to get better and learn how to have that kind of a conversation when we see someone that we love who's struggling. So thank you. I really appreciate it.
I think on the medication piece, in terms of psychiatry, so there are specialists in the psychiatric community who are called reproductive psychiatrists. And so they're especially aware of any kind of contraindication, or the impact of certain SSRIs and antidepressants and anti-anxiety medication on a person's ability to, grow their family, and the impact it has on fertility. But I always say that if a person is struggling with their emotional health, they need to be able to take care of that so that they can take care of their baby. And
Exactly.
that always comes first. And so it might be a series of conversations, but choose selectively. Not every psychiatrist necessarily knows how certain medications are going to impact that. And thankfully, there's more of an awareness, there's more education going on. But do your research before you make that call.
Absolutely. Absolutely. Okay, I'm incredibly indebted to you for having this conversation. It's an incredibly important conversation about, just the interpersonal relationships between two people who are trying desperately at the end of the day to have a baby, and what that looks like, and in their marriage, in their partnership, and how to work through these different struggles. So I thank you very, very much. Please tell people where they can find you.
Sure. So they can find me on Psychology Today. They can find me in the Yesh Tikva support group for men, which is actually meeting this coming Sunday evening. And you can get there by signing up through yeshtikva.org. And I'm available. My email address is bleicherlcsw@gmail.com. And I'm happy to help, consult and speak to whoever needs a little bit of a listening ear, a little bit of support. And I just wish everybody who's watching hopefully has gained something that they can take away, whether it's for themselves or be able to share with a loved one and somebody they care about, to be able to support each other. And hopefully we'll have a brighter tomorrow.
Amen. And I personally have gained the fact that I think I now can finally pronounce your last name, Bleicher, because I think I've butchered it every which way during this conversation. So thank you so much, Michael Bleicher. I got it right? Okay, good night, everybody. We will link Michael Bleicher's information so that you can reach out to him. And again, thank you so much for this conversation. Good night.
Thank you.